Here we go. Well, good morning, everyone. Happy crispy fall morning. I think Trish noticed I decided to pull out my flannel the first time for the season. I thought this was a fun fall outfit for you all. Uh, Thank you so much for joining. We're both letting people in. I've got a few announcements, and then I'm going to turn it over to others who have announcements. And then so excited that Trish Farnham is here to talk about essential jobs, essential care. So we have a lot to get into. Go ahead and start. You can say who you are and in the chat line and where you're coming from. I'm doing double duty, looking at all kinds of things. I do have a few quick announcements before you get into announcements that you think I'm going to say. So, let's see. A few people have asked about the Zoom links for these meetings. Just to remind you, the Friday facts and this monthly meeting, we always use the same Zoom link, the one that ends in 1096. So if it's helpful, you can go ahead and copy and paste this Zoom link into your calendar invites. I'm sorry that um, we don't have a better way to do calendar invites, but just know that we always use the same Zoom link for these main events, except we have different Zoom links for our symposium that's coming up. So, our Joining Our Voices, Envisioning the Future of Serious Illness Care. It is going well, the planning. Lots of folks have been doing lots of planning behind the scenes. It's October 30th, Wednesday the 30th, Halloween Thursday the 31st, and November 1st. We have a really great lineup. Registrations are coming in really nicely. As of a few minutes ago, we had 77 folks register. Yay! You do need to register to get the Zoom link. It is the same Zoom link for all 3 days when you register. And there was only so much information that we could put on the registration link, thanks to feedback from Karen and others. Jessica was able to add more registration information. So when people register, they automatically get registered for all 3 days and they get the same Zoom link for all 3 days, and they get calendar invites that put it on their calendar for all 3 days. They can go in. If folks just want to attend one day, they can delete it personally off of their other calendars for the other days. But we are hoping that once folks, whoops, we're going to let more people in. Oh, thank you, Jessica. uh, we are hoping that once people register, even if they were coming for one event, stay for all three. It's 90 minutes each day, and more folks are coming in. That's great. So, just to let you know, there was only so much we could put into the registration, and we weren't able to make each registration day have a different title. So it goes on your calendar as Joining Our Voices Symposium and has the Zoom link, but you don't have to attend all three. The other things about that, we were able to put it on our website. It is, if you do the drop down from the events, there's its own section for um, the Joining Our Voices Symposium. What's been a little quirky is if you double click on events, it goes to our events calendar. That's all in some complicated code that was created. And so Jessica is phenomenal with her tech wizardry, but is trying to figure out how to also have it be on the events calendar, which is choosing to be a little complicated. So a few of you have noticed, oh, wait, it's not on the events calendar. It's because it has its own, if you do coalition events and do the drop down menu, you can go right to the Symposium 2024. It's just not quite on that calendar. So we are quite aware the website is not as user friendly as we would love, but it's getting there. So, any questions or comments, please feel free to put it in the chat line or come off mute. We caught that some things, and thank you those of you who caught that. You're like, oh, it's not on the events calendar, but it is on the website. And so when I'm sending out the link, I don't just send out our website, I do the website. And in fact, I am going to do that right now in the chat line. Sorry, doing two things at once. Just so let me put that in our chat line right now. So you have it. People are coming in. Sorry, clearly my okay. So there's the direct link to our website. That goes right to our joining our voices. So do be encouraging this through your different social media channels. Some of you have gotten emails with the information, not just our coalition emails, but I've sent you direct emails because a few of you have asked for narrative because it's easier to forward. If any of you would like an email that's not our typical, we send it out through MailChimp, not our coalition email. But if you want a direct email with me with all the details and narrative, if that would be easier to send to your groups, either put in the chat line or send me an email and I'll send you information that can more easily be shared with your email groups. We being me, I am stronger on LinkedIn. And so just reposted yesterday on LinkedIn with the full conference brochure. I didn't realize we could do that, or symposium brochure, that it could be 4 pages. So if you want to forward from the LinkedIn, look at the North Carolina Serious Illness Coalition or me personally, and then you can forward with the full all 4 day all 4 flyers. There's a main flyer and then there's a flyer for each day, day 1, day 2, day 3. And Jessica put so much work creating these beautiful flyers. Trish and Karen and Steve and other folks really helped to sort of get it. So do take a look at those. The great flyers for all of them. Trying to see. I think those are my main announcements. I do want to say just a reminder, we've got a lot happening besides this meeting. Next Friday, we have Betsy Barton joining us for Friday Facts to learn about her work with Transitions LifeCare. So we've added things, we didn't swap them out. So we've got this meeting, we've got next week's Friday Facts, and then all kinds of fabulous things happening the first day, Wednesday, the 30th. It is oh, wait, let me. I want to share it with you. I want to share it with you. Let's take a look. There we go. So here's our great poster for the first day. Are you all able to see this? Yay, great. Good, because I saw Trish, she gave me the thumbs up. So this is our main poster, and you can see this has all kinds of information on it. And then if you go down, there's a great poster for the first day on the 30th. We are in this together, how the caregiving crisis affects all of us and what we can do about it. So it gives information, and then that was in partnership both with Essential Jobs, Essential Care and Trish, which you'll learn more about if you don't already, and then our own fabulous North Carolina Caregiving Collaborative and Karen Appert and all the work we're doing with our partners. Then day 2, October 31st. I love this Halloween topic because I think it's a little fun and a little spooky. The future of AI to improve care and caregiving. And Steve, Han, and Connie, and our friends at ARP have helped to put together a good lineup of some really interesting new products that are coming out from the AI world. And then our colleague Mitchell Josephson from Health Data Management will be giving sort of an overview of what's happening with AI. I don't know about you, it's both exciting and it scares me quite a bit. So I think it is a good Halloween topic. And then our last day on November 1st, we have the My Superpower documentary. Super excited. It's a 10-minute documentary about Kat. I still need to find out how old she is. I'm going to say she's around 12 or 13. She lives with NF1. And so we'll watch the documentary. And then we have Kat and her mom, Krista. We have a woman, Cheryl. We have Kat, Krista, and Cheryl. Cheryl's husband lives with NF, so they're going to give their own personal account. And what's it like having your story shared in a documentary? And what do they want other folks to know about living with serious illness, both from the child perspective, the caregiving perspective, the wife perspective? And then what would meaningful change look like? We also have the producers and representatives from the Children's Tumor Foundation. So that should be fun to be able to watch and then have a conversation. I'm gonna stop sharing now. any questions before we go to any other updates? Any questions about the symposium, about upcoming meetings, about life in general? I don't wait long enough, but I hate silence. So the other thing is I do want to give a shout out to Karen Appert and the group, the North Carolina Caregiving Collaborative, have put together a really, really thoughtful list of donation options for our friends in Western North Carolina. I have linked to that. If for some reason you're not getting the emails, let me know, but we have put a link to ways to do meaningful donations. Yes, Sue, I add that Karen, it has been very helpful. It has helped me to target my different areas of donations, both financially, and I see Mary Bethel and the wonderful collaborative that happened among our aging organizations. And so that's great. Dementia Alliance worked with the Diaper Bank of North Carolina to do a supply drive. And then a number of other organizations. Karen has good connections with a food bank. So I'll just share. I was like, I gave there, and it just so many people are hurting. And then there's just added complexity to our more vulnerable folks, older adults, adults living with disabilities, families with medically complex children. So it has, for those of us who are feeling incredibly powerless, at least we know we can donate to places that we feel like it's making a difference. So Karen, thank you for that.
So Heather, can I just make one statement on that? So,
Please.
yeah, I think it's great that all the donations are coming in. I'm hearing from a lot of people in Western North Carolina, their warehouses are just overflowing and they really need money now. So I think I think it's good that people, whatever people want to donate, but I think the overwhelming thing I'm hearing is just people need financial resources.
And I'm glad that you brought that up. That has generally been my understanding in disasters as it is that financial resources are usually what people are wanting. What was very helpful was I'll use the Dementia Alliance when they gave a very specific ask and they said, hey, if you can get things to us by October 11th, here are very specific. I know for me and my own caregiving world, so I could really understand it. I don't know how many people are donating incontinence supplies, are donating Ensure, and I did diabetic nutritional supplements. So I loved that they had a very specific ask and by a very specific time frame. And so for those people who wanted to give something, or those that are doing it, but yes, if people have not asked for specific supplies, go for money. And then there are a few folks that are asking for specific supplies and have a way to get there. But yeah, I'm seeing those pictures too. And that was my question. Are things going to get overwhelmed with stuff? Early on, there was like, hey, don't just give clothing and furniture if people don't want that yet. So I'm really taking the lead from the organizations themselves who are asking. And I think soon enough, and I know I've talked to some friends who would like to give not just money or supplies, but would like to give time and would like to volunteer. And so we'll kind of keep on the lookout for those groups that are asking. I know there was very specific requests. Don't just go and show up. You are getting in the way. But then there are some very specific asks that people are saying, hey, this group or something. Any other general comments or symposium comments? Okay. Ooh, I realized. So let me now turn it over to Karen to give a caregiving collaborative update.
Thank you. Sorry, had to unmute. Just quickly, I think we mentioned on the last call that one of the big things that Heather and I as co-leads on the Caregiver Nation Network that the National Alliance for Caregiving is supporting through a grant that we received it's basically phase 2 of the Changing the Care Conversation grant. the three goals that we have as a group for the Caregiving Collaborative are coalition building for that group, which just includes, making sure that we get the voices, all the voices that we can. Anyone who is doing anything related to caregiving, as we've mentioned before, caregiving as a top priority focus, as opposed to just a part of something else they're doing. We're trying to make sure all those voices get collected in our group. The second goal we have as for this grant project is to analyze the landscape of existing caregiver resources in North Carolina. We know that's a big undertaking. We're really doing it as a behind the scenes. It's not going to be consumer facing at this point. What we're trying to do is make sure as a group that we know the resources that are out there, because we know that you can't find the gaps until you know exactly what's out there. And we also want to understand better, depending on where you are. As you all know, caregiving resources can look different depending on the county you're in, the region you're in, et cetera. And Heather and I had a great conversation this morning with two interns that are going to help us gather some of that data. And I think one of our big goals with that, in working with some of our colleagues on the Caregiving Collaborative and this group, the Caregiver and Patient Engagement Work Group, like Erin Kent and Megan Shepherd-Bannigan on the research side, something they're looking at is what is the framework for even doing that. And we think we can lead as a state, because we've asked on our national network what other states have done this, and other states have done pieces and parts of it, but I don't think anyone's actually done a huge undertaking like this. We recognize that we may not get it all done, but we've got to start somewhere. So we're kind of excited about that and also kind of nervous about it, but I think it's going to be a great starting point for really getting an understanding of what the needs are for caregivers in the state. And then the third goal that kind of goes along with all the other goals is we want more caregiver stories. So we're looking to continue to build on the group that we have of the 10 stories that we had from the first Changing the Care Conversation, the phase 1, and building some of those stories, especially in some of the groups that we haven't heard from, specifically on the pediatric side, on the disability side, on some of the other maybe other needs that are out there that we don't hear as much from, because we have a lot of people that are dealing in the aging, on the aging side of things. So those are our main goals. We're also really excited to be working with Trish and the Essential Jobs, Essential Care group that's connecting family caregivers with direct care workers, and talking about the needs of both of those groups and the support needs and the advocacy needs, because we all know that those two groups need to work together. Family caregivers need direct care workers for help, and direct care workers need the input and the help from the family caregivers to make sure they understand the loved ones and what their needs are. So we've just really been talking with Trish. I mean, we know Trish from a long time, but we've been working with her on separate things for a long time, but we're really excited about this initiative as part of our caregiving collaborative and where that's going to take us into the future. As Heather mentioned, that symposium coming up on October 31st is really the first project we're doing with this initiative, and we look forward to having some of the needs of family caregivers and direct care workers and direct support professionals in front of people, raising the awareness before the election, when hopefully people are going to be thinking about things like that and who they want to vote for. So that's it, Heather, unless I've missed anything.
No, that's great. And I have a quick announcement, though, that election is like such a great segue into just a moment going into a political and legislative update with Lee Dobson. I did realize another announcement about interns and getting the word out and raising awareness. We have another intern that you may have met this summer, Mana Patel, who's going to be helping us with our social media. And we are trying so hard to get more social media savvy. And so even in the last 24 hours, I was finally able to get into our X/Twitter account. Shane was so good setting it up for us. And then we had an intern do stuff a summer ago, like a year and a half ago and then couldn't get in. But as of the last 24 hours, we now are back into Instagram and Twitter, X, and LinkedIn. I already had down. So for those of you who are on those mediums, please, if you don't already, please make sure to follow us. And then also the North Carolina Caregiving Collaborative has a Twitter and Instagram, I think also. And Mana's going to help with both the Caregiving Collaborative and the Coalition. So hopefully you'll start to see more posts soon. I just did my first Twitter post for the symposium about a half an hour ago. So again, that is a medium you're comfortable with. Please make sure to follow, like, share, subscribe, all of those fun terms. And but thank you, Karen, so much. There's so much happening right now especially in the caregiver space that makes me so excited. I don't know what your LinkedIn feeds are about, but mine are all about caregiving issues. And to see so much at the federal level, at the national level, so many folks really talking about it, it gets me excited, both from a topic as well as programmatically, as well as funding. So that's really neat. So from a voting and election and funding, Lee, what's going on with our General Assembly and legislative world?
Thank you, Heather, for giving me the opportunity to share a little bit about the work that is happening at the General Assembly. Back on October 9th, lawmakers came back and passed a Disaster Recovery Act. The governor signed it on October 10th. So it's now session law, $273 million for disaster recovery. And lawmakers are saying that this is just the first step. The Senate leader, Phil Berger, and the Speaker of the House, Tim Moore, said in a press conference that the bulk of the money goes to the state agencies and is giving them the flexibility to use it where they, where it's deemed appropriate, instead of earmarking it for specific counties. And I think that's a very good approach. The lawmakers right now are trying to figure out what is FEMA paying for and what does the state need to cover. And I think that's a smart approach, because you don't want to supplant the money that is coming down from the federal government. Lawmakers are coming back next week on the 24th, and they've said that additional round of funding for recovery is coming. There is a link or a form on the General Assembly website that they've set up for requesting support. And I can put that in the chat so that anyone needing support can put that information in there. From the federal perspective, there's also a disaster recovery centers that have been set up in certain counties. And there's also a FEMA app that can be used. And I'll put that information in the chat as well. And then the last thing that I wanted to mention is that the DHHS, along with Medicaid and EMS, yesterday hosted a front porch chat where each of the agencies focused on the support that they're providing to the impacted communities and the families in those areas. And I thought it was very well done. There was a number of flexibilities that they talked about. There's still more to be done, but I think, we've got to give these agencies the credit for collaborating and working together to try to get as much support that both providers and families need. And the last thing I'll mention is go vote. November 5th is election day. So please vote. I think there's other folks here that are also very in tune with what's happening at the General Assembly. If you want to jump in and add anything that I may have missed, I welcome you to do so.
And Lee, the question, which I think was sort of addressed, but how can Sue asked a question in the chat line, how can we help state agencies address the gaps from county to county?
Not sure. I do know that at the front porch meeting yesterday, they were saying that, North Carolina has a no wrong door. And typically when applications would come in from whatever location, that they would forward it to the right county or group. But what they said during disaster recovery, that the application would be processed by that entity. But I think there's probably more work to be done. Is there anyone else here that could talk to that specific question that that Sue had?
I don't know. All right. I feel like you may be the most in the know, and then generally Mary are the two folks that I what I would like to say as an add-on, and thank you for letting us know that the General Assembly, they are all coming back next week. We did have a pre-meeting this summer. Lee and Mary and myself and some of our interns. Lee chairs our Legislative Policy Committee. It is time to, Legislative and Public Policy, it is time to revise our legislative priorities for the upcoming 2-year session. And so we were waiting until the multi-sector plan for aging was released, as well as hopefully we're hoping ARP friends will do what they did 2 years ago, bring a bunch of us together as a health affairs roundtable to help to discuss the different priorities. And so personally, selfishly, whatever, wanted to get the symposium out of the way, but we will be convening the legislative policy group together to help revise and revamp our priorities for 25 and 26. Some of you joined that group, gosh, it was now over a year ago. If any of you, especially newer members, if the legislative world is of interest, please either put it in the chat line or send me an email, so that way hopefully we'll get a meeting. Hopefully in the next week or so, or 2 weeks, we'll set up a meeting so that way we can come together and really look at our priorities moving forward. And so if any of you would like to join that discussion, let me know and want to be a part of that. And then thank you, Lee, for adding more information in the chat. I think with that, if there's no other questions, I'm waiting to see. I'm excited to turn it over to, and you feel free to have questions later on, we'll come back together. I'm super excited to turn it over to Trish Farnham. For those of you who listened to or participated, just an amazing Friday Facts. Well, now I've lost how many Fridays ago. How many was September? Oh gosh, I can't remember the date of your Friday Facts. It was
sometime in September.
It was sometime in September, whatever, September 13th, I think it was. It's on our website. It's wonderful, and I linked to it. I know Trish and I have been colleagues for more than a decade, I think more than 15 years, and to hear about her personal and professional journey and passions in the disability space, in the aging space, it was wonderful. And I'm so excited that we did not have time in those 27 minutes to actually get into essential jobs, essential care. And I said, I want to learn all about you. That's what Friday Facts are about, to learn about each of us as members and our backgrounds. And let me just do a shout out. If any of you haven't been on Friday Facts yet, and I see a bunch that haven't, let me know, because we are scheduling. We've got some open spots and then a lot of open spots in 2025. It's such a wonderful way to get to know each other, and it's so low key. It's not scary. So anyway, but I asked Trish to come back for our monthly meeting and really talk about the essential jobs, essential care. You're hearing a lot about it, especially with the symposium day 1 on October 30th. So what I want to do is and Trish had great slides, and I was like, we'll keep the slides and let's do them at our monthly meeting. So with that, I'm spotlighting Trish. That's also so when she shares her slides, it will make her face disappear. And Trish, I will let you call up your slides.
Hi, everybody. And thank you for being on this call today, and Heather, for everything that you are doing to pull this group together. Just real quick housekeeping. Can you all see my slides?
Not yet.
Okay, hold on. How's that? Can you see them?
Now we see them.
Okay, it's looking
Not
like we
possible.
have a little bit of an unstable internet connection. So if I start dragging, Heather, don't hesitate to tell me.
Okay,
And
sounds
I'm
good.
really sorry about that. And I feel like this is kind of a presentation among friends. So obviously, I work with the North Carolina Coalition on Aging, and so Mary Bethel and I know each other very well. And Lee Dobson and I actually go way back from when I used to work for the North Carolina Medicaid Agency. So it's really good to be among friends for this conversation. And given that we are friends, and if there are conversations you all want to tease out based on what I'm talking about, don't hesitate to interrupt me, please. I want this to be as productive for this group as possible, especially since you've probably heard some of this insight before. But regardless, I'll kick off our conversation with these slides and look forward to what kind of blooms from there. So like I said, I am affiliated with the North Carolina Coalition on Aging, and Mary Bethel could do a much better job of giving the mission statement than I am, but I think it is important for folks to be grounded in it because it's really was the seed that spawned the Essential Jobs, Essential Care in North Carolina. And so the coalition's mission is to improve the quality of life for older adults through collective advocacy, education, and policy work. And we are a collaboration of over 100 organizational members and numerous individual members. And several years ago, way before I was part of the coalition, our organizational membership was really starting to identify issues related to sufficiency of our direct care workforce. And everybody probably is well versed on what direct care is, but just to kind of set the ground and the stage for it, direct care is essentially those folks who provide oftentimes the hands-on assistance to people with disabilities and older adults who require assistance with their basic living needs, ADLs, bathing, eating, using the restroom, those really essential tasks. And in North Carolina, there are a lot of specific individual descriptions for the direct care workforce. So you may know of folks who are nurses aides, nursing assistants, personal care assistants, DSPs, direct support professionals, aides, home care, home health aides. All of those folks really represent and fall under the large umbrella of the direct care workforce. And our membership was really our membership is comprised of organizations who provide direct services, family caregiving organizations, organizations that support individuals with disabilities. And there was a real kind of increasingly comprehensive recognition that there was a direct care workforce crisis emerging. I know when I was at the state, we first saw the evidence of that direct care workforce crisis back in the early 2010, 2012, and we were starting to see it in the western part of our state, in rural areas. People were not able to get the hands-on live-in assistance or in-home assistance that they so needed and deserved. And so as a response to this coalition's emerging observation, our wonderful former director, Heather Burkhart, partnered with the national thought leader on all things workforce, direct care workforce, the PHI, to house the North Carolina project of the Essential Jobs, Essential Care. This was part of a larger national network project, but in North Carolina, the coalition housed this effort. And then when the demonstration project pilot ended, we actually continued it. So our effort now is known as Essential Jobs, Essential Care, North Carolina. And we work to bring collective attention to this essential workforce and to the policy needs in order to sustain and expand and strengthen this direct care workforce. So we are a very robust and very diverse group of people who come together to think about this particular workforce in thoughtful detail. Everything we do, hopefully my slides are going to switch.
And Trish, I'm going to ask that can you press in slideshow mode just for those of us who have not great eyes, and I'm looking on my laptop, so it's a little smaller for me. So in slideshow,
Yeah,
it might make it
you
a
can
little bigger.
definitely try. Okay. 1 second. How's that?
There we go. Thank
All right.
you, guys. Thank you.
Welcome. And I'm gonna actually, I'm sorry to do this. I know we're doing the spotlight, but I think I'm gonna take myself off video so that hopefully the slides don't drag. So bear with me. Okay. All right, Heather, can you see the 5 pillars? Okay.
Yes. Sorry. Yes.
No, so when you think about the essential role of this direct care workforce and also how multidimensional the challenges are, it can get overwhelming when you think about the dynamics related to this particular workforce. And so in order to organize our own efforts, we align ourselves with PHI's 5 pillars of job quality. So we're looking at these particular 5 dimensions of supporting this essential workforce: fair compensation, quality training, quality supervision and support, respect and recognition, and then real opportunities, looking for opportunities for people to have professional advancement, people to actually build a career from being a direct care worker. And so these are the 5 areas and domains that the Essential Jobs, Essential Care in North Carolina focuses on. All right. This group, I know, knows this well, but the more we really became invested in this particular set of challenges and really wanting to advance the work and the thinking in this particular area, the more we all appreciated how multidimensional and how wide-reaching this crisis is. As you all can probably appreciate, the direct care workforce impacts so many folks that in our system are often siloed. So we have a crisis in the aging community that we know very well, or many of us know very well. The Serious Illness Coalition is very has incredible insight on how this crisis is affecting folks with serious illness regardless of age. There's also the physical disability community, which will often self-direct their direct care services. They're experiencing the same crisis. And then we've got friends and colleagues in the developmental disability community who are also experiencing this crisis. And yet systemically, our service delivery systems and even our communities have been largely siloed in their conversations, in their advocacy efforts, and in their priorities. And ironically, we're all working to advance the same goals. And so what's really exciting for me, humbly, about Essential Jobs, Essential Care's structure in general is that we really bring those different voices together and we create a shared table for us to have conversation and build a shared policy set of priorities to advance this workforce. And so this is just a sampling of our membership, and you'll see that with this, there is a lot of diversity in the group. There are some members who are not, this is a little dated, there's some members that aren't even represented in this group. But we have service providers, folks who provide long-term care services. We have advocates, people who use those services. We have family members, and fundamentally, we have direct care workers directly. We have people who actually represent the interests of the direct care workforce and make sure that our policy priorities are informed by that insight. More recently, and this is really exciting, and Heather and Karen both acknowledge this, we've started to collaborate more and more with the Serious Illness Coalition and the NC Caregiving Collaborative, recognizing the common and shared and mutual priorities within those groups. So we want to, when we talk about what Essential Jobs, Essential Care does, we frame it, and this is maybe a little bit of a nihilistic way to see it, but it's really, it's the truth. We want to think about what are the questions that keep us up at night collectively as a collective. What are the questions that keep us up at night? And so these are the things that kind of drive much of our tasks, many of our tasks that we actually have advanced. So how is the first question, and probably a very well understood one at this point, is how is such an essential workforce so chronically underpaid? In North Carolina, direct care workers have a median hourly wage of $15.52 an hour. And so if we think about, and that skews differently depending on the setting. So depending on whether you're working in a nursing facility, a hospital, or in a home care environment, that may vary a little bit. But $15.52 is the median hourly wage for direct care workers in North Carolina. We know that's not enough, and everybody will say that's not enough. So we have worked and given some specific attention to how do we elevate that particular that wage, that median wage, and how do we do it in a way that is both sensitive to and acknowledges that oftentimes services are provided in a provider setting, and providers also have to make sure that their administrative costs are met. And how do we do it in a way that doesn't just sustain the direct care workforce, but sustains the entire LTSS sector for now and moving forward. How do we mitigate the current decline in the long-term care workforce at a time when the population is growing exponentially? You all know these stats. You know that by the year 2040, our aging population in North Carolina is set to double. Within the next 20 or so years. How do we prepare for the demographic math problem that is only going to get worse? If we look at demographic trends, we know that the age of folks, or the folks who are entering the workforce at this particular point, the number is shrinking, again, as our older adult community is growing. We also know that this problem is going to be disproportionately impacting rural areas. So obviously North Carolina has a huge stake in that particular dynamic. And so we know that we have to think not just about the growth in older adults in our state, but also the fact that the workforce that will be supporting them is shrinking. What will happen to people with disabilities when elder caregivers can no longer provide support? So this is a dynamic that has been interesting because it's really, I think, unified the developmental disability community and the older adult community in really new, and I don't want to say exciting ways because it's troubling, but really important ways. And so it's important to know that when adults with developmental disabilities live at home, nearly all the time, their family caregiver is over the age of 55. So as older caregivers age, what are the impacts to not just the older caregivers, but also to their children who have developmental disabilities? Where will they go? What settings will they need to go into? What supports will they need in order to live and to sustain their lives in the community, in the communities that they've grown to love? And then finally, how do we mitigate the workforce poaching effect from other industries and by other healthcare sectors? It's really important to know that everybody at this point has probably heard about the Walmart effect or the Amazon distribution comparison. Everybody's heard that, and those are real. Those are very real. Those are very real dynamics. It's also important to know that even within the public space, we have poaching effects. So, for example, hospitals can pay direct care workers with the same credentials a whole lot more than home care agencies can. That's a dynamic that's not always fully appreciated, and a lot of it has to do with the way the compensation models work. It's also important to know that other public sectors or other arms of the public sector also pay differently. So the VA has a different reimbursement model than Medicaid does. It's important to recognize that we are sometimes poaching from ourselves, and that we have to be thinking about this rate, this wage and rate dynamic in a much more comprehensive way if we're really going to get at the root cause of some of these issues. The other piece that I think everybody on this call well knows is that throughout the crisis, through the lack of direct care workforce, when there's an absence of paid caregiving, the common denominator in every solution are caregivers. Informal caregivers, certainly paid caregivers, but also informal caregivers. And this is the space where, Karen and Heather and I bond on a personal level. And I just had to share this. So when you just Google caregiving, these are the images that come up. They're lovely. They're sanitized. Everybody's smiling. I find that fascinating, by the way, because my guess is that everybody on this call who is engaged as an informal caregiver maybe looks at these and goes, that's an interesting depiction of my experience. And so I just want to kind of use this opportunity to say, this is what the sanitized Google version of caregiving is. EJEC prefers to focus on the actual version of caregiving. And so I just want to elevate a couple of things that EJEC is doing, as Karen and Heather alluded to earlier, that elevate both the direct care worker. And I just want to introduce you indirectly to my friend and colleague, Denise Lugo, who is on the left. Denise has been a direct care worker most of her life. She is credentialed. She has a CNA. She is in home care, which we're very grateful for. And she is an amazing woman. She's out of Fayetteville. She is just a really cool person. I will also tell you, and I will not share her hourly wage because it's not mine to share, but I will tell you that it is not out of it is not far beyond the median of North Carolina, and it is a wage that certainly deserves to be much higher than it is. And so one of the prongs that EJEC is going to be focusing on, excuse me, didn't mean to have a slide. Oh. One of the questions that we're asking as Essential Jobs, Essential Care is, what should our publicly funded service rates be to really have the workforce we need now and in the future? What do the rates need to be in order to make sure that the amazing folks like Denise have a living wage and can make a long-term career out of supporting folks to stay in their homes and communities and in various long-term care settings? So that's the first kind of policy question that we're really driving at. The second policy question is represented by my sweet husband on the right. And again, I think you all probably know this, have your own personal experience, but just to kind of give you a little bit of his biography, he has been the primary caregiver for his older sister, who is a survivor of acoustic neuroma tumor, and has tumefactive MS. He has been her primary caregiver for over 20 years. And so when we talk about informal caregiving, I think it's important, at least for me to say on this call, how this is a very personal conversation for us too. My guess is that all of us on this call who have been personal caregivers or indirect caregivers can talk about not just the struggles, but the chronicity of those struggles. That it's not just one trip to the emergency room, it's multiple trips. It's not just going at 5 o'clock in the afternoon, it's going at midnight. It's not just the phone calls that you get every other day, it's the phone calls that lead to 47 other to-dos, right? It's the times where you have needed help and you didn't know where to look, even if you were in the system. It's the times where you had support and you had to figure out how to support and figure out that dynamic together between paid caregiving and informal caregiving, and all of the different dynamics that raises in the family, in the home, all of the different role conversations that happen when you are working with other people to support a loved one. And so I just want to acknowledge that this prong of our priorities is actually a very personal priority for me as well. And so we, as Karen alluded to, we are working to support, how can we better support partnerships that mutually support both formal and informal caregivers? So I'm going to go through a few of the things that we are working on specifically, the specifics of what we're working on. And again, Heather, if there's stuff going on in the chat, I don't see it. I'm so sorry. Feel free to interrupt me.
No, keep going, and then there'll be some questions at the end because I'm already thinking of some and some observations. This is powerful and right on.
No, great. I'm looking forward to the conversation. So just wanted to talk about our first priority, and this is that our priority for the last year has been to develop a strategy to address the direct care workforce wage challenge and crisis. And what we are really focusing on is what we've called a rate analysis and strategy. Importantly, Medicaid is the single biggest payer of long-term care. And our state's Medicaid program holds a lot of capacity to really influence those direct care workforce wages and the related rates that are necessary to support both the direct care workers and the organizations that are employed, that where the direct care workers work, excuse me. And so that comprehensive rate analysis is something that this very diverse group of people have consistently come around and coalesced around to advance in our state. And looking to create a comprehensive rate analysis across the different long-term care communities, and that to make sure that rates are actuarially sound, competitive with market rates, and result in competitive wages for direct care workers while also covering the required programmatic and administrative costs. Secondly, we want the rate analysis to examine the wage disparity caused by different rate structures applied to funding the same direct care worker cohort. So I mentioned earlier that in home care, the median wage of workers is lower than those that work in hospitals. Why is that? Why is that? For the same credential and essentially the same function, they are paid vastly differently. And then thirdly, we want to establish a process that ensures the long-term services and supports rate structure is sustained long-term. We know that in North Carolina, and Lee Dobson is as good as they come in monitoring what's happening at the General Assembly. So Lee could probably say this better than I could. Lee and Mary certainly both could. But we know that the General Assembly typically works in increments of the legislative session. And we want to make sure that we are creating a strategy that not only meets the current crisis, but also addresses the future and forecasted crisis. And so with this rate strategy, we're hoping again to look at not only what's happening now, but what will happen in the future. This rate analysis has been reflected and codified in several key recommendations. First of all, the department themselves has reflected this rate analysis recommendation in its own research and study, which came out earlier this year, that in looking at the direct care workforce comprehensively and taking a multi-pronged approach to addressing the needs, this rate analysis was one of the many recommendations that they made. And more recently, the All Ages, All Stages Path Forward also made this recommendation. And we credit our EJEC members for taking this conversation and making sure it is reflected in some of our state's most important strategic documents. So we're really excited about it. And at this point, those resources have been identified and are going to be operationalized and implemented by the Center on Workforce for Health. So we're really pleased with that partnership as well. I wanted to just flag before we pivot to the next part of our priority, something about the Hurricane Helene response. One of the things that EJEC pivoted to when Helene hit was really examining some of the department's flexibilities, which Lee alluded to, about how those flexibilities could best be leveraged to support direct care workers. So as we think about all of those folks impacted by Hurricane Helene, all of the folks who are older, all older adults, people with disabilities, vulnerable populations across the Western region, it's important to also really put some attention and some thought into how are those direct care workers impacted by Helene directly. And so we wanted to kind of flag a couple of thoughts just for this group. First of all, if you are a direct care worker who perhaps is making around that median wage and perhaps is not insured or perhaps doesn't have benefits, and your home is damaged, destroyed, your kids are out of school, it's important to know we've got to think about how can that direct care worker be expected to also report to supporting the needs of vulnerable people when she, and most direct care workers in North Carolina are women, when she's probably managing a whole lot at home. And so we also want to be mindful that there are dynamics where people who use services may have left the region for very valid reasons. They have left the region in order to stay with family in a different part of the state. They've left the region you may not be able to get to them because the roads are out. So there's several dynamics that impact obviously the person using services, but also the worker who is simply maybe just on the cusp of being financially secure herself. It impacts her too. And so we are working with the Medicaid team to really bird dog how can some of the flexibilities that they've identified as being available to service providers and available to people who use services, how can those flexibilities really be leveraged to support direct care workers during this time as well? So not on the slides, but wanted to flag that. The other prong that we are focused on is, again, the one that we keep talking about, that Karen and Heather and I keep talking about, and it's why we're so excited about the symposium later this month. So in partnership with the Caregiving Collaborative and the Serious Illness Coalition, and guided by national efforts, we are invested at EJC in bringing direct care workers and family caregivers, informal caregivers together for the purpose of creating a shared position, create common understanding of the common challenges and dynamics that these two groups face, to have opportunities to share the lived experience, for people to tell their stories to each other and to a larger audience. To do this in a way that informs state policy so that we can really identify those common and mutual policy needs that need to be advanced through this mutual effort. And then finally, to build relationship, like to really make sure that people have an opportunity to get to know each other in order to build relationship and to have an improved and mutual understanding of the experience of the others. So we're really excited to do this. And we're launching that as part of the Serious Illness Coalition symposium in a few weeks. The other thing I wanted to flag is that this is echoing a lot of work that's happening at the national level. There is an increased recognition nationally that these two communities of caregivers really are best supported when they come together. And so PHI is launching again with the National Caregiving Alliance to come together to create the Together in Care model, which is focusing on 4 priority areas nationally that we are also that is also informing our area, or excuse me, our local work. And they are promoting care integration, so making sure that informal and formal caregivers are at the caregiving, the care planning table, as people are, as clinicians come together to make decisions about vulnerable people, that sometimes the folks who know that person the best are also at the table. And I will say, as a disability advocate, that the individual herself is also at that table. The second one is to elevate the importance of the consumer direction model. We know that consumer direction, where individuals and their families have options to hire and retain the direct care workers directly, is a really important resource and a really important tool in the toolbox for solving the caregiving crisis. The flexibilities that it creates are really noteworthy, and this has been elevated at the national level. Third is to strengthen matching opportunities. So oftentimes you have individual caregiver, family caregivers who don't even know where to go to find good fits for supports. And you may have people who provide direct service who are incredible resources, but aren't necessarily easily linked to that individual. And so there is a real investment at the national level to really look at matchmaking services and elevating that option. And then finally is investing in more research, recognizing, again, the very unique and powerful interrelationship between these two groups, and working really hard to better understand how they interrelate and how they can better support each other. So, and with that, as has already been mentioned several times, we're really excited to participate in the symposium this year. And our panel discussion on Wednesday. I think we are kicking off the panel thanks to Karen's hard work and our colleagues at National Domestic Workers Alliance and the EJC. We have a really exciting panel pulled together of family caregivers, direct care workers, providers to talk about their shared positions and their shared platform and how we can all advance the mutual needs of these groups together. So with that, I'm going to stop talking. And thank you all for being on the call.
Okay, so wonderful. Thank you. I've heard about it before, clearly, and I'm on all these work groups, but it's just nice to kind of get the big overview. I know I have questions/comments, but think I'm looking down because I know Sue Deaton. Thank you so much for posting the fact sheet on report of the study of the acute hospital care at home initiative. I don't have a chance to look at it now, but I did see some articles that talk about how so much of the hospital at home model relies on family caregivers, and that wasn't quite thought through. And so there's been some, I don't, pushback's the wrong word, but some sort of exploration of what is this really doing, especially with those of us who have provided very sort of complex medical care for our loved ones at home. And are we really prepared for that? I know Sue started off the questions asking, I'm wondering how, I think GA is the General Assembly views caregiving. Is it the sanitized view when we're looking at those happy pictures, or the reality? And maybe it's good, especially following Lee Dobson's talk legislatively, both at the state level and the national level. What are you seeing in terms of responsiveness or acknowledgement?
Is that, I'm so sorry, Heather, is that a question to Lee or to me?
No, that's a question to you, Trish, but I know it's coming off of, Lee gave a legislative update, or, you can answer and then other people can.
Well, I'm going to largely defer to our policy experts, Lee and Mary, who are on the call. But I will say, in the direct care workforce space, I think there has been increased attention to the need. This is when the General Assembly starts hearing the same thing from lots of different informed sources, it tends to get their attention. And so there have been, over the last couple of years, I think some really important initiatives related to the direct care workforce, elevating the wages of the direct care workforce, and also the training needs of the direct care workforce. There's been increased attention to it. I think it's a fair statement to say, and Lee, Mary, correct me if I'm wrong, is that there is more work to do. The other thing I will say is that to your point, Sue, about the sanitized view or the reality, my guess is that it's both, depending on their own experience. Many folks in the General Assembly are caregivers themselves, and so in some ways that experience transcends politics and transcends party in a way that I think personally is really refreshing. But as far as where caregiving and supporting caregivers fits in the priority compared to other priorities, I think that the jury's a little bit muddled and are still out. So Mary and Lee, can I hand it over to you all to add to that answer?
Yeah, I would agree with what you said. I think there has been attention, particularly with the workforce crisis that was identified, particularly that was exacerbated by the pandemic, that the General Assembly, when it came to trying to put more resources, financial resources into home-based care and out-of-home placement to keep workers in, they did some things there. I would say that I think there's limited attention focused on support for family caregivers. We have not seen any outside of maybe a little bit of money every now and then for things like respite care or things like that. But we really haven't taken a comprehensive approach, or the General Assembly hasn't taken a comprehensive approach to looking at things. We don't have a state tax credit that can support family caregivers. Our family leave policies are fairly weak. And, those types of things are controversial, particularly like leave policies, because if you institute leave policies, then how are you going to pay for, those types of things? And is it going to result in bigger problems than what you have now, with employers not wanting to do it and things of that nature? So I think there's a lot that can be done. We just had a policy committee meeting for the Coalition on Aging, and we went through some of these same discussions, and we were just having about the types of things we can put in to support not only family caregivers but direct care workers and things like that. So I think the multi-sector plan on aging that's just been approved and released, I think offers a good foundation for beginning to address some of these issues, because they're issues that were addressed in the plan and identified that the fact we've got to move off square one where we are now to make a difference in these areas.
Mm-hmm. And Lee, love to hear any comments. I will say that one of the things I'm looking forward to after all the symposium craziness, is really diving in not just to the multi-sector plan for aging, but Karen and I have been in meetings with our national colleagues through the National Alliance for Caregiving, and they have a whole list of policies that they encourage states to enact. And you spoke to some about paid leave, and I looked at that entire list and was like, how's that going to fly in a more conservative state? Because they hit businesses, they hit small businesses a lot. So it'll be interesting to look at the list of policy suggestions both nationally at the state, and then really think about what could actually is reasonable to expect. Lee, I didn't know if you wanted to chime in.
Yeah, thank you. I agree with what Trish and Mary are saying. I think to answer the question about the level of knowledge of what care in the home really looks like, or care in general looks like, it all depends on whether they've have had a lived experience. I will say that our organization works to take legislators on home visits, and we typically target those legislators that are on very specific committees, and try to give them, firsthand experience of, what care in the home really looks like. That approach has been very helpful in getting them to better understand the breadth and scope of what's possible at home, and also the challenges faced by the supportive systems that are in place. And we're, you know, continuing to work on doing more home visits, also capturing staff and client stories that we can share with legislators on a regular basis. I'll put in the chat this platform that we have that people can either record their own video, 20-second video of what care is like, or what their challenges are. And we can use that with legislators, as well as a more one-on-one approach, if that's what they'd like. But yeah, it's, so I challenge everyone here to work with your constituent legislator on educating them on the challenges that you're seeing on a day-to-day basis in this caregiving.
Mm-hmm. And I did want to say something, and then I see Aaron's question, that we are seeing more conversation on the national level with the election. I mean, on the state level, ARP did great videos about the governor candidates and how they felt about caregiving and some specific actions that they talked about. On the national level, it is interesting to start to see the platforms. I know the Harris platform talked about adding a home care benefit to Medicare. And so I think this issue of care, I hear it more in the aging space, the elder care space, as opposed to disability, but I do see more conversation starting to happen in actual platforms. Aaron asked a question, do we know of any state legislators that are family caregivers or that have had the experience? I know that last year when we did our Capitol visits in DC, Senator Tom Tillis's office, he speaks openly about it, his work with his family members, and so he was really pushing and introduced some bills. I have talked to some folks personally, folks that I know in the Orange County area, and when I talk to them, I realize not just is it an issue from the big picture, but I mean, I was at an event and found out they're also struggling with it with their own parent. And I was like, all right, here's my card. Let's talk about it. So it's an opportunity to provide some one-on-one support for those who are caregivers. So I don't know if the question is, yes, well, I'll let others say. We know that state legislators are, it's just how do we connect with them? And is it like a quiet whispered support, or is it a more public information?
So, I mean, I think from the home care community, we've got a lot of champions. Representative Donna White is a huge champion. She's, previously a family caregiver, supporting her parents, I believe. Senator Moffitt has a brother living with intellectual and developmental disabilities, and he takes on that support as well. the speaker had his parents just recently, I think it was his father who died in hospice and had hands-on some challenges with just care delivery. So the list can go on. Representative Crawford is part of has the Tammy Lynn Center with individuals living with intellectual and developmental disabilities. So I think if you just do a little bit of research on the members that are currently serving, you don't have to dig too deep to find those. I think the challenge is, does that translate into actionable steps that support increased, Medicaid rates, increased funding for paid sick and family leave? That's a little bit more challenging.
Mhm. And a comment and a comment. I guess issues that I see, both there's the government response and then there's also the personal response. Some of you know I work with caregivers and families every day that are looking for home care options or looking for other senior living options. And I think there also is this awareness about this is what you saved for. Let's not just, I have family members that are just really struggling and their parents, or they're, even when there are some funds, they're making the decision to use it, and that, well, I don't want a stranger, I want you to be doing it. And so I think there's a whole awareness about what can we do as a government, but also a kind of a private soul searching about, and I've talked about this, interdependence, and when it's okay to bring in help and when it's okay to use the resources for it. And I think those will be really interesting conversations. The other thing that, Trish, you didn't mention here, but you've talked to me about it, and it's become I don't think I've ever used the term a bee in my bonnet, because I come from the aging space. The direct care workers in the aging space generally are CNAs, certified nursing assistants or certified nursing aides, or personal care assistants that are trained in a certain way. And what I didn't know before joining this collaborative is it's a completely different training and certification and regulation for direct care workers in the disability space. And from my understanding, and Trish, tell me if I say this wrong, there are less different kinds of requirements in the disability space, and yet the care is almost the exact same. The direct care work is the same, and yet we put, I think, slightly different barriers on aging caregivers. And so that's something I really want to explore, because as we look at the workforce crisis, are we over-regulating it, or regulating it in a way that, if you're helping someone with total care in the disability community, why is it different certification regulations for that direct care person than in the aging space that's total care? And I had no idea about that until Trish got me all riled up about that.
And just so folks have a maybe a sense
say
of
it better than me.
what we're talking about. What Heather is talking about is one of the other efforts that the coalition supports, is what's called the We Care initiative, and that's really working to elevate the training and the capacities of all direct care workers, and doing it in a way that is very sensitive to the workforce demand, and what is actually needed in the field to support people well. And it's what she's talking about is that depending on the licensure requirements of the agency that the individual works for, those licensure requirements may look different for somebody who is otherwise maybe similarly situated with the need. So somebody who is supported at home with a developmental disability, who maybe has cerebral palsy, so needs assistance with transferring and bathing and eating and all of the ADLs, maybe under a different set of training criteria than Denise's, who is required to be a CNA to work in home care, and maybe doing very similar tasks, if not exactly the same tasks. And again, it's a really good illustration of the siloing that has happened in our aging and disability community, within the service and the licensure sectors. And there are some you know, there's some pros and cons to each, right? Like it's not, I, having been a former director of an organization that supported people with developmental disabilities, including people with really significant support needs. I have to say sometimes the credentialing really helps elevate the skill set. So it's not a good, bad thing. And at the same time, what we often do in home care is we over clinicalize something that frankly needs to be human first. And there's space for us to think through how do we support people thoughtfully and in a person individualized way, where the credentialing is a support, but doesn't necessarily dictate the support. So that dynamic is kind of what Heather was alluding to, if that's interesting to anybody else.
Thank you for saying.
Heather, this is Mary. I'll make one point too. So I know that many of us on this call are going to be developing legislative agendas for the long session coming up. So I know that we all have kind of interest in supporting caregivers, both family and those that are paid to do it. I think is a lot of value in us being coordinated to the extent we can on what our asks are of the General Assembly in this regard. So as we develop our agendas, I hope we can have conversations about how we can have some maybe unified language and unified strategy about what we might do on this.
Yeah, I love that. And I love that the Coalition on Aging has already started to work on that. Our timing worked well last time we did this because we were intentionally a step behind, so we could sort of gather some of the information. Clearly, we at the Serious Illness Coalition take leadership on a number of things or one or two big things that address advanced care planning, but very excited to work together to be in alignment. And then also, as I've said, and then in other conversations, really loved that health affairs roundtable group that got together 2 years ago, where a number of different groups came together and said, okay, where are we all in alignment? Who's looking at this? Who's looking at that? How can we have shared priorities and shared language? And then are there other things that should be added into each other's? And so very excited about that collective effort. I want to wrap up because I want to have the work groups have a few minutes to be able to connect, but are there any other questions, comments, emotions? All right. We will, Trish, please, I may already have them, but please make sure to share these slides with me so I can share them with others. I know those questions that keep you up at night. I really loved that it helped center me and the questions and the issues. And so I'm loving that and want to be able to use that. And then you're seeing the love come in on the chat line. That was really incredible, Trish. So I echo that from Erin.
Very, very generous, very kind. But this is, I really appreciate the opportunity to talk about it and to have dialogue about it. It mattered.
All right, thank you so much. What I want to do is give the work groups just about 20, well, we'll meet till 12:45. So we will break up for about whatever that is, 26 minutes. We'll break into our work groups. For those of you, I think a lot of you have been put into the advanced care planning and clinical practice work group. There is the caregiving and patient engagement work group, and then there is the communications, advocacy, and education work group. So everyone can kind of go into your work groups now, and then we'll come back together at 12:45. But Trish, thank you. And feel free to join the caregiver work group if you would like to be a part of that as well.
Would love to. Have to pivot, but would love to. Would love to.
I'm gonna make sure everybody gets into their groups. Trish, that was wonderful. Thank you.
Oh, it felt tired. I'm so sorry.
Oh, it was
Sorry.
So it was not tired at all. It was powerful. Thank you.
So,
Hey, just real quick to jump in. I went to the break room and then there was no one there. So I'll try again, but
Yeah, which break room was it?
CPE.
Yeah, Karen should be there now.
Okay.
Okay, and then Susan, I put you with me in the clinical practice and advanced care planning work group. So hopefully you got an
invitation. Yes.
Invitation. That's the word I'm looking for.
Thank you, Heather.
Hey, Trish, thank you.
Thank
You
you,
are
Trish.
released, but that was really helpful.
Oh, well, thank you. I appreciate it. And Jessica, thank you for all the work you're doing. I haven't seen you in a couple of days.
doing
I know you
it.
are. I know you are. Thanks, you guys. Okay, have a good Friday.
Thank you too.
Heather Altman, I'm going to get on your schedule with Karen sometime next week. I'll send the email, but just so that we can kind of huddle on tech and anything else we need to wait before we need to worry about it.
Fingers crossed, I plan to be in this state, so that's good.
All right, y'all have a good weekend. Happy anniversary, lady.
Thank you. Thank you.
Okay, bye.
Susan, are you still with us? Susan?
Susan, if you can hear us, we can't hear you because you're muted.
Can we put Susan into a work group for her?
I don't think I can.
Oh, there we go. She did it. Hi. All right. I get to go join the work group with Jacob because we worked. Great. Thank you, Jessica, for adding that. All right. I know that was quick work group time. Hopefully it was enough to get some interesting to-do lists or brainstorming or collaboration going. I'm going to turn it first to Steve Hahn because I'd love to hear from everyone, but clearly we've got our big symposium coming up, so I'm sure you have comments about promotion and other things from the communication, advocacy, and education work group.
Yeah, I actually want to use most of my time to encourage people to tune in on October 31st. We think that this is going to be very interesting. We were lucky to get 4 entrepreneur CEOs, all part of a panel from San Francisco to London to New York to right here in North Carolina. So we have a company called Asha AI, and they're doing a lot of work in prescription drug compliance. We have a company called Renee.com that's developing apps to really make it easier to be a part of a patient caregiving team, so personalized care at home. Another company too in that same space out of England called MyCare. And they too are working on AI for personalized care at home. And a person that some of you have heard from before as part of Friday Facts, but Carrie Yaya, right here in North Carolina, we're hoping too, joins that panel. So that's at noon till 1:30 on the 31st. And I'm really hoping that these CEOs get some good audience questions so they feel that it was time well spent. And so hopefully that you and others can join us for that session. It's come up in our committee that ideally we'll have agendas for the website. So we'll forward Heather that information today. But for those panels or for the programs that you're planning too, if there's a little bit more information so folks can know exactly what to expect too, I think that would be good in our promotion. But for ours, I'll have a short video promo to share as of Monday next week. So start pushing that out. We are just kind of talking about, once again, going back to a guiding star post-election to just get together and really discuss what should our 2025 priorities be. How can we move and advance the Advanced Care Directives Bill in the long session? May require some changes to that bill. We're not sure. Also, for those of you who are Friday Facts audience, I know Heather and Connie worked really hard to fill out the 2024 lineup. I think we've got a couple guests already for 2025, but if there's names that you want us to reach out to too for program guests for next year, it's never too early to submit those so we can begin building that lineup for next year. So that was pretty much the crux of our conversation, short conversation this week. But as always, share your ideas, and we look forward to some success in the long session.
And actually, I looked at the calendar. We had some changes. So actually, our November spots are free. So if people have suggestions right away, I've been thinking about, we do want to book our 2 Friday facts for November. So if folks haven't been on it yet and would love to be the focus of highlighting, let me know, let Steve know, and we can work on those. Because I did, Steve, I was going to email you. Our November ones are free, I see. And I will say that Neil Shaw from Care Yaya, he was in our symposium last year, but just last week they announced they have they are a tech company, even though they also do matching for caregiving, and they just announced a new AI telephone support for older adults who are experiencing loneliness and isolation. So he saw the announcement on LinkedIn and said, speaking of AI, we have a brand new product. Or a new initiative, can we join? And so that was exciting. So yeah, all 3 days are going to be super. And I think it's really interesting. All 3 days touch caregiving. In past years, last year was a little heavier on the advanced care planning side. And this year, all 3 days connect in some way back to caregiving. And so I love that. Speaking of caregiving, I'm going to turn it over to the caregiving and patient engagement work group.
So this is going to be easy and quick because it was just Aaron, Kent, and I. Aaron had some trouble getting in, so we just had a few minutes to talk. But interestingly, you all heard all that we're doing on the caregiving collaborative side. So Aaron and I spoke a little bit about going back to our wish that the caregiver could be included in the EHR much more easily, and going back to the work of the CARE Act over the last 10 years and the fact that our state didn't pass it. And the two of us actually both got on our MyChart EHRs and realized that there is a place in there on Epic to, if you're adding a contact, you can actually say that contact is a caregiver. So that's a great step. But to her point, not a lot of people know about that. And in fact, if a researcher wanted to query, how many caregivers are actually included in the EHR, I think it would be really tough to find an accurate number on that, because a lot of us who have been doing this for a long time didn't even realize that was an option. So, we may have a new educational and outreach and awareness project that we want to work on about how better to get people to know that that's a really important thing for caregivers to be recognized in the EHR. Anything else, Aaron? I know that was just that's really all we got time to talk about.
Yeah, no, that was great. I think we're going to try to talk about that in a little bit more depth, future CVE meeting and or a caregiving collaborative meeting, and try to compile some any sort of evaluative evidence on the implementation of the CARE Act as a future direction.
That's great. And it does, yeah, some of us who break into our family members' MyChart are able to put our own information, if those of us who are caregivers who also manage our loved ones' chart saw that. But it does make me think that at a recent meeting with the folks from Duke, Nicole Claggett and Cooper Linton were saying that they have there is some new program newish program with the Duke Health System for caregiver tracking and support. Basically, it makes me think that there's more to think about, and maybe pull in and see what they're talking about. Jacob.
Yes, we talked about community education, especially advanced care planning. We have several educators in the group. So we're talking about compiling a list of these educators and really looking at how we could meet maybe quarterly or regularly to talk about best practices around advanced care planning, talk about, different forms, different methods, different things like that, realizing that we're all doing this kind of within our own bubble, and coming together, we could, really communicate and help more folks. So that's something that I think would be interesting for people. I think it would engage people in this group or new folks in different ways. And then, maybe we become the resource for that, as well as these other initiatives. So I thought it was a really good conversation.
Thank you so much. And as an administrative or leadership note from the coalition, and I just said that to the clinical practice and advanced care planning, I want to take due respect from the Caregiving Collaborative, which is bringing folks together and naming it and having some clear focus. And it just became clear that there's so many of us that are members who are going out in the community or educators. Well, let's come together. And for lack of a more creative name, I kind of like, for now, the ACP Educators Collaborative. That we are educators to come together to share information and resources. And I think as a coalition, it helps to clarify, we have these different work groups and we have different initiatives that we are connected with within each of the work groups. So people, new members especially, can more easily see themselves, as Jacob say, and figure out how to get involved, and also how to share support and resources. And as some of you have heard before, we are connected with the License to Give Trust Fund Commission grant. We do have grant work to help to promote education. And so it just made sense that those of us that are educators also bringing us together. I don't want to overly work group us, but I also want to make it that the work of the coalition is clearly defined, and sometimes naming things helps people understand it. And as an educator myself, even the different forms, and those of us that are notaries realize it'd be nice to be able to share some best practices. Any questions for any of the work group chairs or follow-up? Okie dokie. So I will do some last minute reminders, which is next Friday. Betsy Barton is going to be Transitions LifeCare, and I'll be on, but Connie will be facilitating that interview. Steve, you unmuted. Did you have a fun announcement?
Yeah, sorry, I wasn't quick enough to unmute. With Aaron on this, let's not forget our friends out west here, and I hope everything is okay there. I know there's a lot of ways to give back. If you haven't done any charitable contributions, there's an option through the ARP Foundation where they're matching grants up to $1 million or funds up to $1 million. Yeah, our hearts go out to you, Aaron, and we're here for anything you need.
Okay. And so yeah, thank you, Steve. That's a good reminder. I think it's good to end the meeting the way we close the meeting, encouraging registration for the symposium, but also really encouraging you to go back and look at that great list of donation resources that Karen Appert put together for the Caregiving Collaborative. And there's a number, I think, is ARP's one on that group? Yeah, so ARP is also listed on that. So find ways to get involved and to support where you can. And any other last announcements? I did put a thing out if members wanted to do announcements about other activities. All right, we see Steve's hand, but not, okay. All right. Oh, Mary, you're muted. So if you're, yes.
I have a question for you about the Care Yaya thing. Can I ask you after the meeting?
Sure.
Thank you.
Absolutely. And any other last comments? If not, well, I don't want to cut it off. Okay, so you get 2 more minutes back to your day. I hope I am off to have it is my 26th wedding anniversary, and my husband and I are off to go vote. That's what we decided to do for our wedding anniversary, is to go to the senior center here in Chapel Hill, the Seymour Center, and do some early voting, and then go out for a late lunch. So may you all go vote too, and hope to see you all next Friday and through lots of emailing random things.
Thank you.
What I've heard about the lines at early voting, you may have an early supper.
I know, right here. I'm going to stop the recording. Here, wait, stop recording.